Hello, dear colleagues and friends. Welcome. Good morning, good afternoon, and good evening. I'm CS Wong, Assistant Director of CCOUC. It's my pleasure to be the moderator of today's CCOUC 10th Anniversary International Webinar Series on Health Emergency and Disaster Risk Management, supported by our various global partners. Let me remind you that participants' audios are muted and the webinar is being recorded. At the Q&A session towards the end of the webinar, participants can raise questions to the speakers using the Q&A function and join the discussion by the chat box. The theme of today's webinar is Health EDRM Education and Training Competencies. Experts will share with you some results of an international research project on health EDRM workforce development funded by World Health Organization. I'm happy that we have Dr. Kayano from World Health Organization Center for Health Development to give a brief opening remarks. And then each of our two speakers will speak for around 25 minutes, and then we will open the floor for questions and answers. Participants can raise questions to the speakers using the Q&A feature. Let's now proceed to the opening remarks by Dr. Kayano. Dr. Kayano joined World Health Organization Center for Health Development in Kobe of Japan in 2015, having previously worked at Nagasaki University School of Medicine as assistant professor in charge of promotion of research activity and international collaboration. He currently works as a focal point of health emergencies, responsible for the communication with local national government in Japan, WHO headquarters, and the regional offices. As the responsible officer for health EDRM, he coordinates the work of the Secretariat of WHO Thematic Platform for Health EDRM Research Network and facilitates global research collaboration and related activities. Asia Pacific, based on his background in psychiatry, he also works for Kobe Center's research activities regarding mental health and dementia. After graduating from medical school, Ryoma began his career as a general practitioner, working with vulnerable populations, such as older populations and people with disabilities. In 2011, he worked for disaster survivors of Great East Japan earthquake as the member of Tokyo Metropolitan Disaster Relief Team. Ryoma, over to you.
Thank you, CS. So it's two great introduction for me. And I truly appreciate CCOUC for this opportunity to invite me to give this opening remarks for this wonderful, important webinar for the improvement of the health EDRM research and also for the population and activity policy program. Good morning, good afternoon, good evening, everyone in front of this screen. And it is my great pleasure to join, and it is a huge honor to provide this opportunity, the opening remarks for this important webinar. As most of you may know, who is joining this webinar will be the familiar with health EDRM, but this is an acronym of Health Emergency and Disaster Risk Management. It's an emerging research field with an integrated concept, including disaster medicine, with nursing, public health, etc. This concept was newly developed by the collaboration of so many international global experts. Especially it started after the third UN World Congress on Disaster Risk Reduction, which was held in 2015 in Sendai, Japan. After that, health imperative has been discussed as one of the core objectives of the disaster risk reduction, which was highlighted in the resulting document of the Congress, which is called Sendai Framework. Responding to this expectation and the requirements for health sectors, since 2016, WHO has been working on coordinating the global research collaboration to effectively improve the scientific evidence on this research field. This initiative is represented by, as CS mentioned, by the establishment of the WHO Health Emergency Disaster Risk Management Research Network, which currently involves over 200 experts from all over the world. And in consultation with those global experts, we have identified 5 key research areas for Health EDLM in 2018, utilizing the opportunity for the Asia Pacific Conference for Disaster Medicine, which was held in Kobe, Japan, fortunately. We identified 5 research areas, which includes the standardization and updating of the research methods, and standardization and addressing the implementation gaps on health data management, improving the quality and effectiveness of mental health and psychosocial support, effectively identify and address the health needs of subpopulations, especially vulnerable people. And finally, the health workforce development, today's webinar's theme. Following this identification, we have started 5 research projects to address each research area. For example, on research methods area, we have developed the WHO guidance on health EDLM, research methods for health EDLM, which was the collaborative activity of the more than 150 global experts to co-author, to write, and also to peer review. So many people from all WHO regions has contributed to the development. This is the first guidance, comprehensive guidance for the how to plan, how to conduct, and how to report the research on health EDLM. That was an important activity, and following that, now we are we are now proceeding a dissemination activity, global dissemination project, to actually use this guidance to improve the quality and the quantity of the health EDLM research. And for this research area, health workforce development, CCOUC has led the global literature review and case study analysis, and also the Delphi consultation for the global experts to identify the key components of the health workforce development. What is the common components for the different countries' project or program? And also they have summarized the lessons from the implementation in countries, more than 10, 12 case studies they analyzed, and then extracted the lessons for the effective implementation, which also the Professor Machino and also so many the experts of the research team has contributed to this project. So as a responsible officer for the health EDLM research in WHO, I truly appreciate your contribution and effort to create this wonderful project, and also to proceed to make this project to almost complete, to identify and to understand more about what is needed, what can be done, what should be avoided, or what is effective, non-effective, for the effective health workforce development for emergency and disasters. So I'd like to just finish my opening remarks here to say big thank you again to Kevin and colleagues for this wonderful project. Thank you, CS. Over to you.
Okay, thank you, Ryoma. So let's move on to the first speaker, my colleague, Professor Kevin Holm. Professor Holm is Deputy Director of CCOUC and an Assistant Professor in Emergency Medicine and an Assistant Professor by courtesy of the JC School of Public Health and Primary Care at the Chinese University of Hong Kong. Professor Holm was the founding director of Hong Kong Rotary Club Disaster Preparedness and Response Institute. He is also a Hong Kong Red Cross volunteer and had served as a field delegate after the Wenchuan earthquake in Sichuan province of China and Typhoon Haiyan in the Philippines. Kevin, over to you.
So thank you, CS, for the introduction, and thank you, Ryoma, for the wonderful opening. Let me just see if my slides are working. Can you see my sharing?
Yes.
Great, thank you. Again, apologies, I can't get my computer, always working. So that's great. It's now you can now see my screen. So yes, as Ryoma has suggested, we have spent the last 18 months working on a series of research studies, summarizing and synthesizing the results. And last month, we presented the results of the Delphi study. and the policy brief is coming almost done now, and we're finalizing the project after 18 months. It's not been easy, especially given the challenges with COVID, but I think the silver lining is that we realize how important HEDRM and all these initiatives are because of the problems and challenges we face during COVID-19. So I don't want to take up too much time. We have Sonoya sharing her experience after me, and we can look forward to have a longer Q&A. So I'll just begin. Again, this project is funded by a WHO Kobe Center, and we're grateful for the support and the collaboration that has formed from this project. So I just highlight in the beginning where we are at this moment. I'm quoting from the WHO Health Emergency Learning Strategy here. It's been highlighted that a major lesson learned from past emergencies is that even the most qualified personnel do require learning and training accompanied by an adequate operational support system to equip themselves for the 21st century emergencies. And that will become more apparent as we look at the different ways that people learn and how we apply these skills for when we're facing emergencies. This is a schema taken again from the WHE learning strategy. It talks about the creation of a workforce of excellence for health emergency. So this is a broad scheme for the overall WHO health emergency response, not focusing on HEDRM. We'll come into that in a minute. But it talks about qualified, experienced personnel, so staff with rosters. It also talks about the outreach and search capacity mechanism, so involvement of volunteers, other allied health workers, when we need to have the search response, and we can, as we have seen in COVID-19, with the task shifting and in order to cope. There are also the partners, the frontline partners that we work with, whether in the health field or in other fields. We do work with a lot of other responding agencies in order to make the response comprehensive and holistic. And all these go in as raw inputs for creating a ready, willing, and able workforce for health emergency work. But what comes after, it's the different layers, right? So there's the training and education, which comes at the top, but as we'll highlight in a minute, it's not the most, it's the first part, but it doesn't go beyond the first part. So the WHE has a core, it's a competency-based learning. So it has a core competency and then also the function-specific capacities. It has also real-time on-the-ground training. So as we know that people forget about the learning, the training 6 months after the formal education. So often people need refreshers, people need to be reminded and to take out the relevant skills, a refresher. And that can be prior to or during the time of emergencies, as we call it, just-in-time education. It has also highlighted that it's important to have learning from social exchange and social learning. So learning from peers, and in all the jobs we have mentoring and coaching, and we work with good peers, good teams. And also we can have, protocols, guidelines available to us so that we can work more effectively. And lastly, but probably the most importantly, we need the job sort of structured job functions. We need sort of on the job experience and learning, so we can have a ready, willing, able workforce for health emergency work. And we see from Ebola that there are these components playing out. So pre-deployment, there is the PPE training, infection control training, and there is in-country training, and then there are the different modules. People had to go into social mobilization, community engagement, with the safety of health professionals, clinical care, epidemiology, contact tracing, case finding, burial, and also infection prevention and control, which it's very important not only during Ebola but also in COVID-19, as we have seen. But all that has led to different ways of layers of training, and it has been developed since Ebola, and probably things have evolved since then. Just going back a little bit regarding some of the training and education and accreditation system, we have seen from emergency medical teams that performed extremely well during Typhoon Haiyan, and also subsequently in the Nepal earthquake and other disasters, that a system, a pre-deployment sort of training accreditation system is very important. And it talks about competence as well as adaptation, and then functioning as a team in a stressful environment, low resource environment, for them to perform. And I think it sort of highlights the different layers. So there is normally a accrediting body. You have a training organization providing sort of training for the personnel, and then they join an organization which recognizes the certification. And here is how competencies comes in. So with evidence, we develop standards. At the same time, we know what are the best practices and interventions, and then we break down into what competencies are needed, and then we go into training so that we can not only provide curriculum that is relevant to the competencies that we need, but also at the same time we can look into the recruitment of the appropriate personnel, and also the monitoring and appraisal system that is continuously assessed throughout various deployments and emergencies. So this is taken again from the WHE. It talks about their core competencies, focus on skills, knowledge, and attributes, as you see on the right. But people often refer to competencies as a summary of skills, knowledge, attitudes, and behavior required to perform effectively in a given job, role, or situation. And so we come into HCDRM. I think the audience is probably no stranger to this concept, but just a reminder that it is derived from disciplines from health, emergency encompassing risk management, emergency management, epidemic preparedness, and also response and health system strengthening. So we look into all these, all hazards, all phases, preparedness approach, and therefore it's important to have a risk management angle into the disaster management perspective that we are facing. And here we focus more on the training and the competencies that is required for these HCDRM managers. Often they are situated in the national health ministries or Department of Health, but it can sometimes be in a separate department under the government system. So actually, there's been a lot of studies looking at various competencies for health providers, for emergency managers, and a lot of the results are that a lot of competencies have been developed and endorsed, but there is no universally accepted and validated competencies, and that's repeated before in year 2000 and until very recently this is still a case. And we will go into a little bit why this may be the case, and whether it is truly possible to have a set of agreed competencies for all. So as Rauma highlighted, we've previously conducted literature review, and we found that again, lack of recognized competency matrix, but some recommended there should be a specific skill set and also a generic sort of response competency. And people often are not defined with clear roles, and therefore formulating competencies may be difficult. And a lot of the published competencies are based on the response phase, and more often on sort of leadership and managerial roles. So it creates confusion as well as to whether a common set is possible. And we also looked in the literature review in terms of what education and curriculum design and delivery, training delivery, it's in the literature. So we found that the blended learning approach it's increasingly being recognized, and participants value the exchange. That it's when they are not only taught in a one-directional format, but there is a dialogue and exchange and utilization application format. So because all adult learners are busy and they probably have other tasks on hand, so hybrid learning appears effective. And what medium, what materials are suitable for web-based, and what materials should be taught in in exercises or tabletops or workshops format, that's also being discussed a lot. And it recognizes the effectiveness or the limitation of the effectiveness of training, and therefore the multimodality and often the repeated learning, continuous professional education is so important. And so knowledge retention we've mentioned just now. So I'm going to mostly focus on a survey that we conducted recently. We tried to map the evidence in terms of what are the core competencies and training curriculum that are available that may be in line with the all hazard, all phrases approach with HEDRM. And this exercise should be able to inform us in terms of a common set of core competencies, and also what are the evidence gaps, and also perhaps research needs in the future. So that's the aim of the study. We conducted an online survey using SurveyMonkey in October to November this year. We invited experts from the research network and also experts from the Delphi study, which has been identified prior through our network. The eligibility includes people aged 18 or above, and they should have relevant experience at working in an institution or providing education for HEDRM. And it's not a long questionnaire. We self-designed this questionnaire with 28 questions in 4 domains. So we focus on competencies, training curriculum, if there is any, also the evidence gaps, and also some of the personal particulars. So in total, we had 65 responses. it's quite a short survey, so the typical time spent is around 8 minutes. So I'll be presenting those results here. So among the respondents, a lot of them are actually from academic institutions, followed by government offices. So just bear that in mind when you're interpreting those results. And we are leaning more towards international responding agencies. So some academic institutions will fall into that. But also in local and national level as well. There is more towards preparedness, but also covering a range of role during different phases of disasters. And these are the countries. So I think there are slightly more from high-income countries compared to low-middle-income countries. So just going on to the results, we asked people what are the knowledge and skills they expect their managers and their frontline workers to be competent in order to manage the risk associated with emergency and disasters. And this is the results combined for both managers and frontline personnel. So it's quite a busy slide, so I'll just walk you through slowly. So we have these 5 different areas of competencies, and they based on the HEDRM curriculum that has been proposed in WHO. So we consulted some of the teaching experts and informing these various skill sets. And we have divided them into management and technical. So I'll be presenting management skills here and then the technical skills in the next slide. You see on the left here, the dotted line is the core competencies the respondents agree to. So the outer line, it's 100%. And as you go in, there is less and less percentage of respondents that responded the yes. So as you can see for managers, actually people expect almost all of them, almost everyone expected their managers to be competent in communication, leadership, organizing risk management systems and programs, and also planning. The majority, or 95%, expected their managers to be competent in applying management process as well. And the orange line is when we ask them if they do have the training curriculum, whether they would cover all these aspects. And actually, they are basically all covered for the management skills for managers. The dark blue line, you see, it's the research priority. So where we think, the knowledge base falls and whether people would recommend further research in these areas. And here are the results, and I'll be presenting the research gaps, summarizing them later on. So we see that the managers are expected to know almost every management skills, but for frontline personnel, some are more important than others. Especially during, for communication systems, it's regarded as very important. And also we see in the frontline personnel that some of the training provided does fall short from the expected competencies. So the blue, the area in the orange line, it's smaller than those in the dotted line. That's another broad observation that we can see, but it sort of skews towards management communication systems for frontline personnel. This is a very heavy slide. Apologies for that. And we probably, again, dividing the technical competencies in all these domains. On the top, we have the managers, and at the bottom, we have the frontline personnel. And again, we have the expected competencies in the white line. So whether these respondents in their organization expects their managers to know, or their frontline personnel to have these competencies. And the orange line shows whether training provided often fulfill sort of these competencies expected. And then the dark blue line is the research priority. So just bear in mind, these lines are not in the same scale. For the top one, it's they are spread out more compared to the bottom one. That's because it's generally expected that managers should know most of the technical competencies, and they actually being provided in most of the training, except perhaps in two areas where logistics and supply systems and also managing information are less often covered by the training curriculum. In terms of the technical competencies for frontline, some are regarded as especially important. So a few that we see is 100%. Emergency communication, again, communication coming into play. Hazard-specific knowledge, so the frontline are expected to know more on these hazards. And communicable disease, as we probably are a little bit biased from our COVID experience. There are items where respondents regard that they are less commonly required, and you can see in the chart here. And again, what I was saying is training in general are less covered for the front line compared to the managers. Again, in line with the management skills that we see. So we asked people, how did they design these matrix? And some of them provided, useful information. In terms of some of them provided, WHO competency models are used. Some of based on research findings. WHO again, CDC, and then some of the other agencies, including ISC, MSF, EMDM, and also ADPC as well. Regarding the curriculum, again, a lot of people took recommendations from WHO, some from research papers and educational companies, software companies, and again, some are taken from local researchers and local expert recommendations and based on prior experience. So in terms of delivery, we see a real mix here. A lot of are still carrying on with didactic lectures, but we see equally commonly online, especially during our COVID time with limited face-to-face time. Practical skills training and tabletop exercise or full-scale exercise are extremely important, and blended learning and work-based mentorship are also highlighted. So workshops and teams, some have selected the role. In terms of the length of the program, it's really dichotomized in terms of some are really short in less than 1 week and others are longer than 1 year. Some require recertification and is most often between 1 to 2 years, but also some of them are longer or from 1 year to 3 years also. And again, in terms of how people decide or how organizations decide on their methods, again, WHO, as mentioned, adult learning methodologies, other new technologies, and adult learning principles has been mentioned, and academia as well. Lastly, the research priorities. We found from the previous slides that the effective leadership and planning should be more research for managers because probably there is a lack of consensus in terms of what level of competencies are expected and how to assess those competencies. For Frontline, perhaps the not so important one is the applying of management processes. In terms of technical skills, again, communication and emergency operations for managers, and communicable disease, emergency operation systems, and preparedness and readiness for emergencies and disasters are the top listed priorities. And there are some other specific topics which we've asked respondents to highlight. I probably won't go through them one by one, but these will be made available on a website later on. So just summarizing and finalizing, we've seen with the recent, especially from the WHO learning strategy and also the WHE core competencies, there is emphasis not only on knowledge and skills, but also on attributes and values as well. And these are useful for recruitment and appraisal processes. So whether in HEDRM we want to emphasize on these is something that we've not looked into, but probably important in the future trend. Whether how do we link the competencies and curriculum, and whether we can actually use it for recruitment purposes or appraisal systems. The other discussion point is, how do we provide evidence, or what level of evidence do we expect for competencies? Because a lot of these competencies are derived from expert consensus. They derive from some of the previous research, performance, and training guidelines as well. So primary research is hard to do, and perhaps as we look into the evidence gap, research gaps, can we look for more solid or rigid evidence to support these learning strategies moving forward? It's an important question that we need to ask ourselves. So limitations for this survey, again, it's done in a relatively short time. So the reach of the survey, of course, biased. There are different organizations, again, more academia is represented here. So maybe it affects sort of the competencies reflected in training. As we know, that competencies are often multi-layered, and a lot of people have talked about not only competencies, but meta competencies, and also the ability to use competencies in a flexible and real-time manner. And that's been mentioned, whether it's a constructivism approach or a reductionist approach. And again, I think there are a lot of academic debates. So we here highlight just the basic functional competencies rather than the more high-ended application-based. So again, this has to be taken into account when interpreting those results. Again, as we go into the curriculum and competencies, the numbers become smaller, and therefore we have to take that into account. On the right, I just want to show you the WHE mentioned about the 70-20-10 breakdown. So again, it may not be agreed upon by everyone, but just bear in mind that learning through training, it's only around 10% of how people learn. And that sort of becomes important as to how we use these curriculums or competencies into enhancing or moving, the rest, the relationship learning and also the on-the-job training. How do we sort of navigate this? It's another important area that we have to look into. So this is my last slide. I just want to summarize. We found different competencies expected from managers and frontline workers. EDR managers are actually expected to master a large number of managerial and technical skills, and therefore, it's important to provide adequate training, not only in terms of the formal training, but also, again, as I was saying, the peer-to-peer and also the on-the-job training as well. We learned about people favoring multimodality training without learning principles, and so the tabletop and full-scale exercises and also the practical skills training has been mentioned. Decision-making and leadership skills are recognized and potential gaps, and there are other research needs that we need to look into in the future. So that's all for me. Yeah, again,
okay.
Apologies. I think I'm running slightly
It's okay.
late.
Thanks, Kevin. Okay, thanks.